1 in 6 people will actually experience infertility during their lifetime, and that's data from a new report out of the World Health Organization. Despite that prevalence, many people feel alone when they're struggling to start their own family. Some experts say, though, that needs to change. Dr. Ariadne Daniel is a reproductive endocrinologist and medical director of the Alberta Reproductive Centre. Alda is executive director of Whole Family Health here in Edmonton. Welcome to RadioActive.
Thank you.
Thank you.
So, Alda, tell us a little bit more about Fertility Awareness Week and the goal of that.
So, Canadian Fertility Awareness Week is about raising awareness about infertility. This year, actually, it's being redefined. It used to be called Canadian Infertility Awareness Week, but this year it's Canadian Fertility Awareness Week, just to give it a bit more of a positive spin, and also to acknowledge that there are many ways that modern families are grown these days. And so even though some families face fertility challenges, they might not actually have a diagnosis of infertility. So it is about raising awareness. It's about making space to have conversations for the 1 in 6 people to share their stories. It's an opportunity for health professionals like Ariadne and myself to educate and provide information and provide resources, and really to change the conversation, to normalize it and to destigmatize the conversation around it, to challenge societal assumptions and expectations around conception, and to help the 1 in 6 to know that they're not alone.
Ariadne, you see patients like that who are dealing with infertility issues at your own clinic. For people who are trying to have children, trying to start that family, when do you think they should be looking at alternate treatments?
Yeah. So the traditional definition of infertility would be to try to conceive for a year, for 12 months. However, we recognize that many of our patients don't fit the traditional family model. We have single parents by choice. We have same-sex couples. And we have also patients who are planning for the future. So patients who are in difficult situations, such as an oncology diagnosis, that are looking to cryopreserve gametes. We're also looking at patients who are empowering themselves by freezing eggs. So if you're looking at the traditional definition, it's a year of unprotected intercourse for patients who are less than 35. But we recognize that there are many different situations that patients find themselves in, and those patients should seek fertility assistance earlier than that.
And what does that assistance look like in Edmonton?
Right. So patients should initially look to their family physician. We recognize that there are a lot of challenges right now for patients to find family physicians. So we do also rely on walk-in clinics to initially see patients and to provide a referral to Alberta Reproductive Centre. We're happy to see patients right from the beginning. So sometimes from the family physicians, they're referred on to an obstetrician gynecologist, which is excellent, but we also recognize they're quite busy. So from the very beginning, we're seeing patients for initial investigations, whether that's blood work or ultrasound. We then will discuss what we find from those investigations, discuss what the diagnosis might be, and then we offer them the possibilities of several treatments. And Alberta Reproductive Centre is a full-service fertility clinic, so we also can counsel them and perform surgery for them. We can move them on to treatments like oral tablets that help to increase the chances of pregnancy. We also have more advanced reproductive technologies, things like intrauterine insemination or IVF.
As a doctor, are you encountering still a lot of situations where perhaps the patient that you have in front of you would have come to you sooner had they known about these options or not faced the... I'm just wondering if there's a sense of stigma being present in some of your clients' lives.
Yeah, unfortunately, I think that is true. I think that people often, there's sort of that expectation that when you want to start your family, you just can start your family.
You can just snap your fingers, right?
And a lot of people spend time trying not to start their family until they're ready. So yes, I think that we have a huge amount of education to do, and that's why Canadian Fertility Awareness Week is so important. Not only to educate providers, refer your patients early. If people come to you and are stressed or challenged or anxious, it's okay to send a referral in. We can simply talk to the patient, reassure them, and move them on. Or we can say, it is time to do investigations. So I do think that there are a lot of patients that if they knew about the resources available and Alberta Reproductive Centre, that they might see us sooner. And for many patients, time ticks by and time really matters. So we know that as we age, especially for egg providers, that can impact the number and the quality of the eggs that we have.
Alda, the stigma that we just talked about, how do you see that play out or play into people's emotions?
It's pretty huge. So, as somebody said, this is a topic that I'm familiar with both personally and professionally. So I've worked as a holistic fertility specialist and acupuncturist for over 17 years. And then I also had my own fertility journey where I tried to conceive for several years and had experienced miscarriages. And, it's like Ariadne was just speaking to, it's, we're taught in school that it's really easy to get pregnant. So it kind of creates this sort of societal expectation that conception is something that just sort of happens. But when you look at the statistics, like 1 in 6, we've known that it's 1 in 6 in Canada for a long time, but with the WHO's more recent report earlier this month, it's actually worldwide. So we know that it actually doesn't even discriminate. And so that's a pretty large percentage of the population.
Which means it's a common thing and we should be talking about it a little bit more.
That's right. It's very common. And yet there is this kind of like expectation that, well, it's super easy. And you spend your whole life trying not to conceive, and then, when you're ready to finally start your family and it's like not happening, there's this sense of, there can be a sense of kind of like shame or like, what's wrong with me? And
did you feel that way?
I did, yeah. It's like embarrassing and it's shame. And it's this, growing your family is a very beautiful and it's a very intimate thing too. And, it can be very isolating and very alienating. And, people don't really talk about it. And people don't really want to talk about it. So I think that's, why Canadian Fertility Awareness Week is so important, is because, again, it normalizes that conversation. So I think that the more that we talk about it, the more, again, we can challenge those, assumptions and expectations, and the more we can let people know that they're not alone. It's an opportunity for us to provide resources like these events, these free events that we're offering.
And I'm curious, tell me about these events.
Yeah, so the first event is it's a community meetup at Kinsman Park under the High Level Bridge. So across Canada, so Fertility Matters is the national fertility organization that supports and advocates for fertility patients, and so they've arranged for monuments across Canada to light up green on Wednesday.
That will include the High Level Bridge.
So the High Level Bridge is one of them, and so we're inviting the fertility community to come and join us. We're co-hosting it, Alberta Reproductive Centre and Whole Family Health. So we're going to provide refreshments and things that light up green, just to create some community around this. Like, I know that in my experience, that was one of the biggest things was having a sense of community. So having a sense of, belonging, where I could like talk about my experience and not feel alienated and embarrassed, and feel heard and understood, and like I'm not totally crazy. And so that's what we want to do, is just to bring the community together. So that's Wednesday. And then on Sunday the 30th, we're hosting a hybrid event. So it's both online or in person at Park Allen Community Centre. And we're offering talk on redefining infertility, fertility, with whole person fertility care. And so we are going to be offering information and resources like free, stuff that's accessible that people can start incorporating into their lives, so that they can feel empowered. And
people can find out more about all of these events at wholefamilyhealth.ca. Thank you both so much for joining us.
Thank you so much. Thanks, Jessica.
Dr. Ariadne Daniel and Alda Ngo. Canadian Fertility Awareness Week is April 23rd to 29th.